What are the symptoms and signs in the broken bones? This is most important to know every person. When a person get injured, that itself where there is the part paining and then swelling, tenderness and deformity, redness will definitely determine that there is an injury to the local part where there is a possibility of fracture. Certain time when the bone is very fragile, osteoporotic because of the deficiency of the calcium and vitamin D, there will be a trivial injury fractures or unknown fractures in the hip regions, spine region and certain bones in the legs, where the person will not have a swelling, but there will be a pain. So, how do we know the bone is broken? The bone is broken, first we feel the pain and we see the swelling, and then there is a deformity, and then when you touch it will not able to move, and then pain increases on the movement and there is a crepitus in the fracture. Such conditions we must aware of it, hence to rule out the broken bone. So, the broken bone, which in these conditions we must take care by splinting, physiotherapy, surgical correction, so that the normal union of the bone takes place. When these bones are injured or broken with the violent or slow process injuries, we must treat according to the displacement of the bone or fracture. So, when there is a much displacement in the fracture, that should be set right with the manipulation and reduction of the fracture and retain with the splint or POP cast. Even though the stability of the fracture is not good, the reducibility of the joint displacement is not good enough, then we must plan for a surgical correction with the implant, fixing the fracture with the implant like screw, rod or plate. So, when you fix it, the person will have a 100% union of the fracture and then recover will be faster. So, obviously, when we see these are the signs and symptoms of the fractures, we should treat accordingly. So, what I told you is in condition like osteoporosis, there is a trivial injury causes the fractures of the spine, hip and knee and legs. In that situation, we should treat the osteoporosis by way of tablet supplementation like vitamin, calcium, minerals, and then there is a deficiency of vitamin D or cholecalciferol. We should treat exposing the patient's skin much more to the sun rays. The early morning sun rays is safe, and the skin the heat of the sun rays will not be much in the morning, so that the rays will be penetrate into the skin to develop the vitamin D supplementation. So, hence when we treat the fractures, we should take into the consideration that the bone mass index BMI test is important, so that the quality of bone to be determined to deal the fractures. So, these are the fractures where we know, however, the best of the best results point of view, if necessary indicated for surgery. So, otherwise most of the surgeries can be managed, most of the fractures can be managed even without surgery, but best of the best recovery or results we need wherever we need the surgery, it is ideally to do surgery for the fractures.